Ready?
Yes.
All right. Call to order the May 19th, 2023 Board of Health meeting. With that, now we can take roll call, please.
Yes. Dawn.
Here.
Jessica. Pam.
Here.
Pete.
Here.
Rod.
Here.
Roger.
Here.
And Ronald Lee. I believe that Artis was not able to attend.
Just need the approval of the agenda and the packet. Motion to make a motion to approve the agenda. All right, it's been moved and seconded to accept the agenda as provided. All those in favor say aye. Aye. Thank you. Citizens comment. First, we'll start with public comment in the audience. I see our audience is pretty limited today, and no face, no head face. So with that, we'll move to public comment on the internet. Janelle, is there anybody that wants to provide public comment?
We have one, and that's Sharon Stratton. Sharon, can you please unmute yourself?
Okay, let me see here.
We can hear you, Sharon.
Sharon, can you hear us? Can you please unmute yourself, Sharon?
I can see you.
Okay, we can hear you now.
Okay. Yeah, my sound is not very good on my phone. I don't know why.
Sharon, would you like to address the board?
Sharon, would you like to make public comment?
I submitted mine in writing, so is that okay?
Oh, okay, yes.
Yes, we received it.
Thank you.
So, thank you for that. Is there anybody else?
No.
All right, with that, then I'll close the public comment section of the meeting, and we will move to review and approve the minutes from the last board meeting of April 21st. Are there any deletions, modifications, exceptions to the minutes? If not, have a motion for accept the motions as provided. That's as provided.
I move that we accept the minutes as provided. Second.
All right, it's been moved and seconded to accept the minutes as stated in the packet. All those in favor say aye.
Aye.
Aye. Motion carries. Thank you. Okay, the first item really on our agenda then is the presentation regarding short-term rentals. Joe, you're going to give us a little update on that.
Yes. I am presenting the GIS layer that I asked Nate GIS to build. And just so you get an idea, this is all of this, the dots on here are licensed short-term rentals or rentals that are less than 10 rooms, which generally puts them into that VRBO type environment. And with a heat map on top of it. So you can kind of see by density where most of them are located. I'll move some stuff around so you can see it. One of the things that I found out yesterday from the Flathead Visitors Bureau is they have identified 2,400 short-term rentals in Flathead. It does not include what's in the cities. And I needed to get some clarification around that, and I did not. But one of the things you'll see is most of the short-term rentals that we license are in cities or are where sewers are located. I want to show you something very remarkable, but you can see where the heat maps show. I'm going to run up to Whitefish here. You can see where the heat maps, where the predominant densities are in the city of Whitefish and on Big Mountain. And if you look around Whitefish Lake, you see very few licensed short-term rentals. I can tell you for a fact that most people would not disagree that we know there more out there. But they have a lot of trouble complying with water and sewer when you get out of the city. They literally have some very strict requirements, so oftentimes they can't do it. Their water supplies are lake water, or they know their sewer is not compliant, and they just don't come to us. So we've licensed about 1,100, and there's at least 2,400 that have been identified by the Visitors Bureau. So that's kind of where we are with this, but I will one way or the other, I can get you this so you can literally see where most of our activity is. But I think it's very remarkable where you can use this from a heat map perspective and see where the densities are. But you can see they're in the cities. Most of the ones in the cities are easy for license, and they're doing that. But we've licensed about, now here's another one, Lakeside, Big Fork, Summers, hey, Seward, right? But when you get off of there, you just don't see that many around by the river. So just kind of a recap on that. I do want you to know that we made it in GIS filters for us, and we will continue to keep this up, and we'll keep this layer active. I don't know, a lot of the stuff we do this isn't public facing. There's no reason why we can't face it publicly. I mean, everything we do is public record, right? We're going to try to think about how we can make this based publicly, and then we'll just keep adding to it as we license. Jess Green gave me the information to get this started, and he feels that we could license maybe 200 during this calendar year, 200 more short-term rentals in this calendar year. But it's still woefully shy of what they believe is out there. But it's a cool map. It's a cool heat map. It shows you where everything kind of is. You can zoom in and out. I really zoomed out tonight. I always do this with the mouse, and using a touchpad, it doesn't work very well.
What are other barriers to having people be licensed? Are there any other, what else is you think is preventing them from getting their properties licensed?
You know, Pete, I think that's a good question. Most of the other stuff is doable. And I mentioned that, you know, for a cost, but it's not an exorbitant cost. Like in the kitchens, we require sanitizing dishwashers. But you can go to most appliance stores now and get a sanitizing dishwasher. One that's got that gets dishes to 160 degrees at the final rinse. You can buy those.
Mm-hmm.
I have one in my house because I'm a psychotic sanitarian, right?
Mm-hmm.
I sanitize my dishes, but you can, some of that stuff, you can't have carpet in water areas. So some of that stuff, most people don't do anymore, but back in the day, when we first looked at condo conversions, you would walk in and you'd have carpet in the bathroom. It's not sanitary. So most of the stuff is something you want to do anyway, but water and sewer can be crippling costs. Mm-hmm. So that probably keeps a lot of them around. But in rural areas,
And is it generally well known within the real estate world of the, you know, just random person opens up a room in their house on Airbnb or whatever, that it should be licensed? Is that education piece out there for people who are just kind of trying to make ends meet and maybe opening up a room in their house sort of thing?
Well, maybe those may need additional education. Most of these VRBOs are being run by property management.
So they should know that.
They know.
Yeah.
They know. One of the things you had mentioned, maybe making it a little more public about you know, getting licensed and stuff. Our staff has worked, our PIO, Leah Freeman, this is, we were thinking about this for a window that we would put these, they would be readily available, that it is a licensed facility. And we thought about, you know, putting them in the yard or whatever, but just a window frame that we could put this in there that when you walk up, you know, it's been licensed and inspected. So we're thinking about that. We also, maybe a certificate, a frame certificate that we could fill out. That could be part of when you walk in, you know that this is a health department function. They do get a license anyway, and they're supposed to place that license. I'm leaning more towards the Klingon, so you can see it from the outside, that it's a VRBO and it's licensed and inspected by the health department. There's one inspection. So that's kind of where we're going with these. And I think I mentioned, we don't chase non-licensed tourist homes around. We have way too much work to do. We will take on anything via a complaint. I hope you understand that we're busy doing plan reviews and inspections and everything else. We just can't sit around and look for these. And they come to us when one comes as a complaint, then they complain about the neighbor that's doing it. And it's a cascading effect, but that's how we handle these. And we have a Flathead, it's called the Flathead rule on tourist homes because we have the absolute most in the state. That we have to do the plan review and it has to be compliant. We do a pre-opening inspection, but we don't have to do annual inspections on these facilities. We only do them on a complaint basis because when the state told us that we had to, I said, not for the license fee that you provide. We need more staff and we can't afford it. So I call it the Flathead rule. We do a plan review, we do a pre-opening inspection, and then we only go back if there's complaints. So I love these maps. I have some other maps that I've talked about that I can either show you now. It's around septic system activity, or I can wait till the action. Let's just get it done. And need to give you a little history on this one, but when I came back on board, I met with the environmental health committee, and I was told, and I heard soon after that, I was told that the environmental health committee was approached by the environmental health manager at that time with a $125,000 package from the vendor that would literally track septic system activity. And I was told very loudly by the environmental health committee that we are not pursuing that. We're not going to spend the money on that. And I said, that's fine. But I thought it was a really good idea. So I went to Nate, and once again, Nathan Holm. I'm going to give him all the credit, and I'm going to make sure that's on the record. I went to Nathan and said, Nathan, can we do this? So he built this for us. And I'm going to zoom out just so you can see. We started this in January of this year. Every icon that you see on here is septic system activity since January 1st. Now, all of these icons have different meanings. A round circle means we're doing site evaluations on them. That means we're going to do soils, possibly groundwater monitoring, such like that. When you see a square, that's actually what we do, a site review, that we just go out, state site, and make sure we're not putting a well in a different location. So this is what the activity looks like. If you keep zooming out, it just becomes this blob of color. But it gives you an idea of what's going on. I want to also show you a little bit about what we can do with this. I want to get out into the area where I do work because I don't want to implicate anyone else but me. Just a kind of a couple of things. When you see a star, that's an application that's been made that has not gone to a sanitarium for any action. So a black star with whatever you see in there means no one's been assigned this file yet. Once the star is gone, sanitarian has been provided that file and they are acting on it. This is one that I'm doing. So if you look at it, it'll give you the name, the Hoffman. It's an active file. It's been assigned to sanitarian Joe Russell. I was out there on the 12th and I did a site evaluation report on the 17th, sent it off for the pump specs back. So this is something that we can use. So, you know, a GIS system was really built for scheduling purposes and efficiencies. So if I'm going out in an area, let's say I'm going out in this area and I see a black star, I can click on that and I can go, oh, that's Stollard. I'm going to go grab that file and assign it out to me. So what we're trying to do is say, okay, when you're going to an area, pop in and take a peek at what's going on here. Grab the file. So I think what you're going to see is our efficiencies are going to grow because we have this tracking system. It's also something we're considering doing publicly facing. We need to take some information off there, but wouldn't it be nice if the public, the person who applied, could go out there and watch their activity on the site? So it's just a nice, it's a planning and implementation tool that was developed, and it gives us a lot of ability to hopefully become more efficient.
So do you enter the information into the
I do now.
database as soon as it?
I'll show you. Let me show you how that's done. First and foremost, you just have to learn how to use the system. But if I want to go in there and do an edit, this little flag here, all I have to do is if I just highlight that and then I just turn on the text box. Oh, I'm not doing this one. So right now, these are all fillable fields. You know, everything, this is like a database. So anytime you fill this field, you're in it. So this is a 228 Gregor Road. It's a site review. It's Fred picked up the file and assigned it to himself. The sanitarians they do their own picking up the file and sending. So he took it out on the 18th. He took the site on the 20th. He did a site evaluation report on the 21st, which means he sent to whomever was identified to put the pump specs back. Don does pump specs. So we would send him the sheet. He would send us the pump specs and we would prepare. Just keep going down. There's the specs they were received. And this permit's been issued. And that's a permit number right there. Okay. So, but Roger, I can go in here and once this is inspected, I can go in there and I can have the date it was inspected, who it was inspected by, if it was approved on that same date. All of these are fillable fields. So yeah, it's nice if you can literally I can hover over any one of these. This is one that I did. It's above Gregor Lake. You can see I did it. And I did a site evaluation report on May 2nd. And I just got the specs back about 2 hours ago. So I haven't had any time to act on it. But that's how it works. And it's a really cool system. You can manage flow, you can manage work, you can manage a lot of things. I want to show you, I have the dashboard. This is actually the same map here, but this is a dashboard. And if I wanted to see who's got what and who's doing what, I can go out here, I can find, right now there's about 90 permit applications that have not been assigned to me. No one's picked them up, they're just sitting in the file waiting. Fred has 187 active files right now. Joe has 10. Not bad for part-time, right? And so you can just actually see who's doing what. But this is the dashboard. We can see the sites that have been visited, not visited, where pump specs have been received. It's a pretty cool tool. And I think that over time, this is going to be we're going to rely on this tool. And I hope that this is what we hope that we can publicly face, take some of the dashboard stuff off. But if people wanted to see where their activity lies, I should be able to go out here and click on this and find out who's doing what and who's got the file and what's been done. And maybe they won't be calling daily to say that we've been to the site. We can use this to hopefully keep the calls down, which just go and turn back. So, any questions on this? It's an amazing tool. It didn't cost us anything.
Quick question, if somebody is calling and wondering what the status is, are you duplicating work right now, or is this going to be all merged? I guess that's what I'm asking. Is it duplicate right now, or is it going to be merged?
A couple things. Historically, we've used an Excel spreadsheet to track all this. We're going to pull that off. Quite frankly, we get complaints about accessibility of environmental health staff because they're really busy. They're out in the field. People call in. Roger, Bars, get the same nod. We're thinking about possibly going to text messaging so they could actually text the sanitarian who has their file, eliminate the cell phone side of it, and they can only text, no one will answer the phone, but at least communication patterns could be a little bit broader. We're looking at different ways of keeping our sanitarian staff busy, out in the field, and not tied to a phone. And we think text messaging may be the next step to just really help that. I mean, you can see just by the staff is really busy, and when they have to sit around and wait, and then we get the speed dialers that just go through every sanitarian trying to find out where the file is. Well, it just once again it slows everything down. And we've added more support staff. We've identified more support staff to help environmental health. I mean, we need to be more responsive to the community about this, but we can't be so overly responsive. So, Rod, we're really trying to really focus energy in this and looking at other communication patterns that will give Roger, when he's got a project, when he had a project, and he wants to know what that's going on, maybe the ability to text the sanitarian and not tie up.
I've been using it through COVID. I found that we were just these things were getting passed along, so I could start getting emails in the sanitarian. They would email me back, and I had their address, so that's pretty much how I've been able to work with. Because some are very responsive. Sometimes I don't get responses fast I should, but most of them are very good.
We're working on every communication strategy to not destroy our ability. So, any other questions about that? I really can't say enough about what GIS do. I'd really like to take the commissioners and understand that how important this platform is.
Well, I said on the meetings when it's brought forward with that expensive. And I asked the question, yeah, I asked to it. I was told all the time. So thank you for stepping forward. I figured they could. Great.
No, it's a neat tool. And we talked, I mean, Jen knows in population health, I've never talked to Ronnie about it, but any application we can use GIS for, population health has some stuff that we can do. We need to use it. And the thing is when we can use it and face it publicly facing, it just makes us more transparent as an organization. So stay tuned. This is just one that we're going to try to turn and face publicly. And there'll be other applications out there for us to do.
Yeah, somebody did a nice job. That was exactly what we were looking for in that committee, you know. And we went around and around with a couple vendors, and they could not produce that level of detail, that was for sure. So, yeah, it seems like the next thing is to roll this out for public access, just like when you go on the GIS now, and accept it.
Well,
It's just a logical next step.
we will continue to work towards that.
I had a question. How quickly is that updated? In other words, if someone walking in the office and puts an application down, how quickly is that posted?
This, if an application comes in, before it's set into our file system by zones, that record is put on. So as soon as the application is received, it goes in on here, and it would look like this. This sort of black star, not the dark stuff, the black stuff. But that's how it would work. So it would be, and you would know exactly. I can turn on this, and I can tell you that the application came in on the 30th of December. Now, this is actually right, and it's steep slopes and a lot of bedrock, and they knew when they applied that there was no way we were going to get to a test hole until snow was still on. And the mud one day, right? So they knew right away. This is not, you can see this has not been signed anymore, but I know that this owner has another application with Crystal in our staff right now. So I don't know why this one isn't been filled in, but there's another one. There's another one somewhere around here. But yeah, so this is posted to GIS as soon as the application is received. It's put in a file, and then when you pull that out, now it's the sanitarian's responsibility to start making the edits. Which has been a real culture change for someone like me, because I actually don't follow too long. Say that. Everyone else knows that. All right, hey, we'll continue to work on
Yeah.
it.
It's great.
Yeah, it's a great tool.
Right. All right, so we will move on to department reports. The first one on the agenda is the animal shelter. Cliff, you're up.
Good afternoon, Mr. Chairman, members of the board, distinguished colleagues. So I have 4 items here I'd like to report on. One of them last week, we met right here in this room with the sheriff, his animal control officers, health officer, and 2 members of staff, Lisa Dennison, Marissa Wenham, and we talked about the rabies program and how we can make it stronger and define a few areas that we weren't covering well. So I think we did a good job about that. But one of the things that came up was we pointed out that the shelter was not doing the best job it could on protecting the public. And what we've been doing is people come in with a dog that they say, I'm afraid of my dog. He bit my neighbor. We didn't report it, and I want to give him to you. So I was the one who most of the time would say, you know, you want to think this through and make sure that if this dog bites someone in here, there's always a chance they might come back on you. We can't adopt animals out like that. So what we were doing was we were so intent on trying to explain to people their liabilities that we may have been turning away some dangerous dogs, and we're the people that need to protect the public from those dangerous dogs. So I believe we're going to see, and rightly so, just because it's our job, we're going to see an uptick in euthanasia numbers. And what I'd like to do, 2 of the reports that I used to prepare this report do delineate owner requested euthanasia or court ordered euthanasia from shelter euthanasia. Our stated policy is that we euthanize for dangerous behavior, or in the shelter, or for quality of life. And so I think I'm hearing, if I hear no objections, we'll kind of show 2 line items for euthanasia from now on and try and track that. But we are we see the error of our ways, and we're going to fix that. So the shelter population has been trending upward. And I think I've mentioned this before, but it seems to us we're not tracking this because we just don't have enough admin people. But the housing crisis has caused some landlords to stop renting to tenants with pets, or to charge fees that maybe some can't afford. So we're getting a lot of, those are the majority of, especially our dogs. We get a lot of cats that way too, where people are very broken up about it, but have no choice but to turn their animals in. So what we decided to do is we're going to try and be a little more proactive in a couple of ways. And we've started a program very quietly and carefully called the Keith program. KEITH stands for Keep Them in Their Homes. And a lot of times, I'm going to go look at a house right here in Kalispell this afternoon. A lot has a fence on 2 or 3 sides, no other fence. The couple is, and this is designed for me to work with landlords and incentivize them to, say, if you're not now renting to pet owning tenants, could we improve your property for you and have you agree that you would do that? So actually it's fairly simple in downtown lots and smaller lots. We have a lot of kennels that are panels of chain link fence panels, and we can clamp them together, have a few corner posts, and set up a secure fence in very short order. And if we have the landlord's permission, we can also put a flap door with they make really good flap doors now with magnets, because what most of the damage that happens that we hear about from landlords is there's a couple, they both work, they're gone to work all day, the dog gets bored and starts doing destructive things. So there was one of the news companies got wind of that. We've been trying to just quietly roll it out and try to find the best way of doing it, but we're getting more calls on that. So, and very positively, and people are good too. We've had a couple of people call and say, hey, I'd like you to build me a fence on my house. I've been needing to get around to that. Well, this is really for renters and landlords, and the landlord needs to show that their behavior will change so that the shelter's operating costs can reflect lowering with fewer animals and offset the cost of building these fences. So we think that'll be a potential lowering of population. And there's a couple of programs around the United States where there's a company called Open Door, and they've got a vet billing system. It's called vetbilling.com, where they will, if the vet will work with them, if they will do veterinary procedures on a payback method, these people will underwrite the payback. And there are some hoops to jump through for the vets, but it's been very successful where it's working. And I've been on a couple of Zoom calls. I actually know both the people that are very active and running this program. So, and I think we've got a good enough relationship with the vets in this valley now that if we go in with I've also had an idea that our medical facility sits empty 3 days a week. If we could get volunteer vet care, perhaps 1 day a month, we'd need 12 vets to offer some low cost for needy people vet care, and that will keep animals out of the shelter, because I can tell you there's a lot of people that say, I'm going to tell you my dog's got cancer and I can't afford to treat him, so I want to turn him in to you. And if we can help prevent that, we'll also lower our operating costs by keeping our population. So I'm working on that one. We'll see how it goes. As a point of information, the legislature passed a bill this last session requiring the licensure of veterinary technicians. And the shelter community works very closely together. We have a a conference call every month. And we've tried to work very closely with the Montana Board of Veterinary Medicine on the rules package they're coming out with, because all across the country, it's an industry practice to vaccinate dogs and cats on intake. It keeps diseases down and that sort of thing. And of course, when you go to adopt your animal out, there's a little value added. So it comes back in the form of adoption costs. And so we're hoping that some of the practices that we're doing, we certainly don't want lay people involved in surgeries or dentistry or anything like that. Like, I think the veterinary community has respect for that, but this committee, the Montana Veterinary Medicine Society Corporation, the president is our contracted veterinary facility, Calm Animal Care. So Barbara Calm is very in tune with, what shelters need and that sort of thing. So I think we're getting some good support there, but our fear is that we're going to have a bunch of new regulations that drive up our costs or that we can't live with. So I'll keep you posted on that. And lastly, on these monthly calls that the shelter community has, somebody said, we haven't had a educational conference for the state of Montana for quite a while. I said, we just happen to be building a building that would have some suitability for that. So we're planning on hosting a statewide educational conference in October. And I think we've got it fairly well planned. And so that's sorry. Any questions?
I have quite a few questions. Hi, Cliff.
Hey.
Specifically regarding what regulations you're going to have if you're euthanizing quote unquote aggressive animals. So like a 5-pound Chihuahua, but it's, someone that startled it or a child that was probably manhandling it is going to be euthanized. Is that some case that could happen?
Well, we normally, what we've been euthanizing have been animals in bite cases. And one of the rabies options that's in our forms is you can either have your animal quarantined at a fee for 10 days, or you can pay a fee to have it put down. That's what we've been doing most of that. But we've had people coming in that say, I have a dog that bit somebody, but there's no bite report on it. And so we need to be the protectors of the public on those animals. So we're probably going to bring them in, test them for a couple of weeks and see if they can be handled. But if we can't handle them in the shelter, we certainly cannot let them out in the public.
Sure. I just want to be sure that, and I know you guys do a wonderful job, but is, there's a lot of different animals that bite for a lot of different reasons. And rabies is probably one of the very last. I think we've had one recent canine rabies case in remembered history in Montana. So I just want to be careful that we're also not just euthanizing dogs that, like, say were being hit by a child, or, an old dog or some dog that is actually just trying to protect itself, and then it comes into the shelter. And or also the staff, we know that veterinary staff is hard to find, which you were just bringing up. Thank you for that. And our profession has one of the highest suicide rates out there, mostly because of burnout. And so I wouldn't want to see our wonderful Dr. Gordon, kind of just come in and have to euthanize a bunch of dogs that are healthy and happy and otherwise wouldn't be a euthanized animal. I think it's extremely important that there are some very strict regulations put into place regarding the implementation of just euthanizing dogs that have no official bite report and have just been anecdotally said to be aggressive. I think it's a kind of something that we should really have a lot of thought put in behind it. And I know you guys have been doing that, but I think the input of a veterinarian in every case should be considered.
So, yes, maybe a couple things I mentioned to you, because a lot of our rabies regulations do follow the health officer for most of these actions. But we have some very good animal control officers out there that make some of those assessments. And oftentimes quarantines happen in the home, even if it was, food aggression or something like that, where a bite report's never going to happen. Without a bite report, we will not take action. We may take that dog in pending a bite report, but we need that field, we need that look at that animal from an animal control officer if there was a bite. Oftentimes, as Pete knows, the bite reports could come from a medical care provider. And those are pretty, when you're stitching up someone with a significant laceration, it may be pretty significant that we get that bite report from a medical care person, but we also expect that to be field investigated by animal control. We understand this. Animal control will ask to quarantine in place even some bites because it's a pretty low risk animal. Euthanasia is not going to happen indiscriminately at the shelter. But it takes this whole system of working together to get to this point where the animal that needs to be euthanized is the one that gets euthanized.
And I understand that, and I support that. The way it was presented, it was that owners could come in and just say, my dog had a bite, and then request euthanasia, and automatically euthanasia would occur, which is a little, it's kind of a slippery slope, at least when you're trying to protect your human staff from just attrition in the field and doing something else. When you come in and just euthanize dogs, it's a real hard thing to do, especially if you've dedicated your life to caring for dogs. So I'm just saying that that's also something that should be considered as part of the equation, that it doesn't become something that is misused.
Also, I used the example of someone that said my dog is bitten and it was not a reported bite. And those are the hard ones. We're not going to automatically euthanize on someone's word. And usually there was no one there but the dog owner or the family to know what triggered that bite. Was it completely unprovoked and the dog is completely dangerous? Was it provoked? So those we're not going to know. And those kind of dogs, if we have a tip-off on that, we'll be watching them closely. But we also know that people bring their dogs in and say, this is the sheriff himself said, everybody's dog is the nicest dog they've ever seen. And however, that might not be the truth. And we'll uncover that. We will be waiting and watching and testing, and we have a pretty good staff. People that have been there a while, even the new ones, listen and learn, and so we'll try to protect the public without indiscriminately euthanizing.
And can you tell me kind of what the rate is? How successful are we at making sure that animals are licensed and have proper rabies certification in the county? And is there any push towards doing that?
Well, we do advertise. We have 4 television commercials, and we take out newspaper ads. I'm sure we could do some things on social media better, but I think we've done a hard push on letting people know that there are ordinances out there. Licensure is one of them, and rabies. I don't know if you know, we don't let dogs or cats out of the shelter without being current on rabies, and we don't let dogs out of the shelter without a license.
And will you provide, you talked about having maybe someone come in and provide relief or low cost care. Would the shelter be willing to provide rabies vaccines for dogs during that time?
A rabies vaccine at the shelter is $10 right now.
Okay, so someone could come in and just get that done.
If someone can't afford $10, they probably can't afford dog food. We try not to be judgmental, but I don't know how much for somebody who says I don't have $10.
Because we had just I know the Animal Advisory Committee and we talked about some rabies clinics perhaps, and I just feel like if this is going to be kind of the next step of accelerating aggressive dog care, that we should probably start also being sure that our animals have their current rabies vaccine, just to help make that decision a little bit easier for everyone. So that's my questions and comments.
Your input is much appreciated.
Any further questions for Cliff? All right, thank you, sir.
Thank you.
Community health.
Hello, everyone. I just have a few updates for our programs in community health. I'll start with MCH. So as you guys know, our MCH project for the year was Safe Sleep. And per Pete's request, a few meetings back, you had asked us to reach out to midwife practices and incorporate them. And over the last quarter, we have gotten the 2 sites, so Fern Creek and Birth Insights, to participate in our program, which is great. They do about combined 20 births a month. So they have partnered with us and we're getting that information and those resource packs out to them. And we have also expanded our services with Logan Health to include NICU packets, so packets for preemie babies. We did 2 safe sleep demonstrations at community events in April, where we kind of demonstrated those safe sleep practices. And I think that's about it for MCH. Home visiting, we got down to a 0 wait list. So we have been able to get our home visitors, our new home visitors fully trained, and each one of them are working on building their caseloads to full capacity. So that means each one of them roughly has about 15 referrals that they're working on right now, which is a lot. Typically, we try to just handle 3 to 4 referrals at a time because it's a lot of effort to try to engage these families, especially since some of them have been on the wait list for 6 months or so. So each one of them having about 15 they're doing some pretty good work right now. And they did have the opportunity in April to go to a pediatric mental health symposium in Fairmont, and they said that was a great conference, and they learned about ways to help with their pediatric clientele with mental health issues, and some good resources there. Immunizations, huge month for travel consults in April. I think we saw, and this isn't a statistic we put on there because it's just now booming, but I just had Jill do some numbers for me, and we saw 22 people for travel consults in April, which is quite a bit. To give you a rough idea, a travel consult takes a few hours. So 22 months is a lot. So they will do a thorough consult of the entire travel itinerary and get you lined up with anything you might need, even for the travel to just like your stops in different countries to get to your main endpoint. So sometimes it requires certain things, even if you're just in the airport. Most vaccines that they are giving to people include like those hepatitis vaccines, tetanus, typhoid, yellow fever, those types of things, making sure that everything is current for any possible encounter you might have on your way to your country. And I just had Joe look this up for me before I came over here, and we had a lot of people going to countries in Africa, and then we had a huge group of people all going on this trip to Peru. So those were the main travel points in April. We'll see what May brings.
Antimalarial prophylaxis needs to be a discussion as well, obviously. Right.
Yeah.
As part of that as well.
Yep. WIC. So one thing WIC has been working on over the last month is a partnership project with the Montana Food Bank Network, where we're one of their sites to help get them information from a participant perspective on barriers to WIC and how to improve it on a state level. So they did host one of those meetings in Flathead in April. We had some participants show up, not as many as we hoped, but we still had a good turnout. And then that is transitioning into a partnership for us with North Valley Food Bank. So we're in the starting phases of trying to get us to go into North Valley Food Bank once a week to do kind of outreach and participant signups. And we'll see through what that's going to look like, hopefully starting this summer, and potential for that to turn into like an outline clinic where we follow ups. So having a clinic in Whitefish. And then we are trying to ramp up on our farmers market program as that starts here shortly with the vouchers being sent out in June. So we're working on our marketing and our farmers training. I think we're going to have about 14 farmers this summer. Any questions? Thank you.
Thank you. Thank you. All right, Jan, the population count.
Okay, so as Cliff said, we met with the ACOs and the shelter staff and then our communicable disease staff. So what kind of came out of it from the communicable disease part is that what Sheriff Hato had indicated to us is that their ACOs are taking more volume than a lot of their sheriff's deputies. So we were going to try to work with them to try to take some of the things that they were doing, and we were going to try to do them behind the scenes so we don't make it as busy, so that when they're actually going to go do something for us, it's of value for them to go do it, especially with the bite reports. So Jim Wardensky, our new long-term care person, he also has a law enforcement background. So he looked at our forms, and we're going to be changing some things, and then some processes came out of that we need to change and to hopefully streamline it for the ACOs and then for us as well. So that was actually a really good meeting that we had with them, and I think a lot of good came out of it. So coming up at the end of May is the Mammo Bus, and we're going to be up in Hungry Horse. So we've been making a lot of appointments for that. So that is really good. We did some outreach up in the Hungry Horse area and visited some of the bars up there and got our flyers out, and we've been getting people that are up there, and we've been making appointments. So it's been really good for that. Wendy Olson attended the Summit Safety event, and they did about 26 car seats. So inspected about that many. And then she also certified more car seat technicians for our valley. So that includes fire department, nurses. So hopefully that will mean that more people are going to be getting car seats checked in the valley, which is super important. So we also got a grant from Town Pump, and that will help pay for some car seats, so that we'll be able to provide car seats for those that can't afford them. We've been doing outreach in San Andreas County. We had quite a few whole health department staff attended the 300 and 400 training, ICS training. So we got all the people that weren't trained prior. We got them trained up now. So almost the whole health department that would need to respond to an emergency has a 300 and 400 training. Malia helped Cliff make up and his staff make up an Instagram account. So everybody follow Flathead Shelter Pets on Instagram. We're just staying away from the Facebook realm right now to just kind of push out the cute little puppies and kitties that are at the shelter. So Mandy also came in and talked to all of population health to explain the syringe exchange program, and there was like huge people really appreciate it, so that there's better understanding. So that's really great that we're getting back to communicating with the other divisions and finding out what everybody's doing, and hopefully be able to help them whatever they need, and vice versa. So that was a great training that they did. So any questions?
Thanks, Jim.
Yep.
Good afternoon, everyone. So as you can see, the past few months, our patient numbers have been hovering around 250, which is about 25% more than we're seeing on average. We're really pleased with this. It's been June 1st will be a year since we separated from the community health center. And I know when we were navigating that separation, there was a lot of questions if we'd be able to keep our patient numbers up. And compared to last April, we saw almost 100 more patient visits. So not only are we maintaining, we're exceeding what we were doing when we were with the community health center. So that's exciting. It just took a while for us to get fully staffed, but now that we are, we're building that patient load and meeting the community need. We've been doing online scheduling for about 4 months now. We just pulled some data this morning, and about 1 in 6 patients are utilizing the online scheduling to book their appointment. So as word gets out, we're hoping to increase those numbers and continue to decrease barriers for folks to be able to make an appointment and get in quickly and get their needs met. So spring is a very busy time for our health educators and family planning. We just finished doing our growth and development education at our elementary schools. The past 8 weeks, our health educator went to 12 different schools and met with the 5th grade classes and talked about growth and development, and reached over 500 fifth graders here in the Valley. So we're in almost every elementary school, except about 2 here in Flathead County. So just finished up with that in time to go to the public high schools in the next couple of weeks and meet with freshman health classes to talk about pregnancy prevention, STI prevention, and discuss our services with the freshman health classes. So we'll be really busy in the next couple of weeks. Our syringe exchange program in April, we had a higher than average return rate, which is nice to see. And right now we're hovering around 50% for our 12-month average, which is where we'd like to be a little bit higher, but we're still above the national average at 50%. We also just received a new grant for hepatitis C prevention. So one of the goals of the grant is to increase our rapid hep C testing and then also navigate those folks to care. So we're seeing that there is an issue between someone getting their hepatitis C rapid test and then meeting with a care professional to start treatment. So this grant funding is going to help give us the resources to navigate and bring more people to care. That is it for family planning. Any questions?
So then the way that it's working right now, say a patient wants to do like an Nexplanon or an IUD, and or they're learning about their different options, and then they refer then over to the community health center to do the Nexplanon, or are you guys doing Nexplanons and IUDs and all of that?
We provide LARCs on site, and then,
Okay.
I would say if someone came in, I'd say 90% of those folks are going to get over that day. So one of our goals and metrics is to provide those same LARC insertions, and we're providing them at free or lower cost compared to primary care. So we do a lot of LARC
great.
insertions.
Good.
Yeah. Other questions? All right, thank you so much.
Thank you. Good job.
Good afternoon. So our mosquito season is well underway. We are definitely seeing quite a few larvae out there. Temperatures have been pretty cool. That's led to kind of a slower than normal start to the season. Overall dry conditions as well. We've seen a lot of our snow melt areas dry up, and we are starting to see flooding occur along the rivers. It's been slower than normal, but I anticipate quite a bit of flooding as the heavy snows that are still up high come off. Rain is in the forecast, and as we move into summer, I expect us to be very busy. We're already seeing quite a bit. We're also really feeling the growth in the valley. We are mapping new sites weekly at a rate that we just haven't been in previous years. The last few years have been busy for it, but we are definitely feeling the effects of growing population and growing development in areas where people previously haven't been moving. I'm very thankful that we have all of our staff. I don't know what we would do if we were struggling with staffing like other departments are. So I did include some of the inspection and treatment totals in the report up there, but as of this morning, just to give some updated numbers, for May, we have 1,105 total inspections, 196 treatments for 323.04 acres. That brings our year-to-date totals to 1,456 inspections, 473 treatments, and 761.62 acres, which is fairly normal in terms of treatment supply. Questions? All right. Thank you very much.
Thank you. Environmental health, Joe, are you taking that one?
So, presentation. All right, just a typical month in the neighborhood for environmental health practice, 142 food service inspections. Not atypical for this time of year, but we have to pick up, we will start to pick up in temporaries. Temporaries are just coming online, start to get nicer out, but those activities will pick up and you can kind of see that if you're looking for July type environment. So we'll start to see more of that. Received 110 septic system applications last month. After seeing that GIS map, you can see the type of activities that are going on. We did put about 50 septic systems in the ground inspected. And no comment on subdivision activity. Folks probably follow this in the paper on our food service inspection stores. Anytime one comes up and you're worried about or wondering about it, you can go on the website and you can literally go to that facility and look at the inspection results. Primarily the more critical items that were happening, we find those on our website. We always give you, if there's something that's a low score, we'll give you a low scores report. And we've had any this month, but anytime you start to see C's, minuses, you can see low score reports generally. Questions regarding the report?
Yeah. No,
Finance. Sure.
Good afternoon. Just a quick budget update. The budget from our last discussion through fine tuning dropped about 100,000 in expenditures due to a reduction in healthcare costs. And there were some other personnel changes. So therefore, estimated mills have dropped about 0.33 mils due to that. So, and of course, then mill levies, of course, are also determined on our cash balance at the end of the year too. So that was good. Schedule-wise, we're looking yesterday. Joe met with commissioners to discuss the health department budget. The 29th, there will be a preliminary budget adopted for Flathead County. Coming on about the first week of August, we'll receive the tax evaluations from the state, and so then we'll sit down and look at that for no levy purposes. And then August 30th, of course, then there'll be a final budget hearing and adoption. So those are just some of the dates that are coming up. As far as the regular finance report, cash balance in the general fund about $1.5 million. That's before our May tax receipts payment that we'll receive this month. We got the second installment coming in, so we're in good shape there. The home health department had a negative cash balance of about 143,000. There was a third payroll for the month of April, and so that has not improved quite yet. So that's holding in there, and so that if we take total cash and net accounts receivable, we're sitting at about 111,000. And I think that wraps it up for me. Any questions?
I think the board needs to know, especially with those that are on the home health committee, you know, our Kirk's watching this closely. We still believe that the ability for us to possibly still move this towards a better place. I mean, it's getting harder and harder to see the positive side of this. I think that the board's going to have to, I think the personnel or the home health committee is going to need to sit down and make some decisions about the future of home health as a Flathead County program. And we may not have the model that makes it work. We just want to do that. And for us not to keep this in our vision would be foolish. And it would be, we need to be good stewards of the money that are provided to us in this community. So just keep that in mind. And I think we really do need to meet soon. As I forget who else is on it. Rob? No, you're not on there. Pete. But we should schedule a meeting soon and kind of break down some numbers.
Yeah, because I mean, if you break out the third payroll in there and how we did from just accounts receivable that month, you said, can you give me those numbers? I'm looking at your report here. So how did we do from that standpoint?
So we were down about 100,000 at the end of last month. And then because just the way it turns out for the month, we have a third payroll. There's 26 payrolls in the year.
Right.
Usually it's 2 or 1, obviously. But this just happened to be a month where that third payroll hit, and payrolls are about 50,000 total. So that's how we got sort of close down to where we're at. And McBee, who is the firm that we were in touch with, collect our accounts receivable, expects that we'll probably collect some cash here coming up the road as their changes have taken effect. We've received some cash, but it seems like home health has just had periodically these one-time expenses, and it slowly is just holding down a little bit.
All right, thanks, Kurt. For the update. Welcome. Randy, everyone, for the help.
Super quick. Cases have come up. Predictable that with the sub variant that we would see in 150 cases, we certainly have. Nothing like we saw at the beginning of this calendar year. Take a look at that. But it seems remarkable that we're seeing the cases go up a little bit. Our hospitalization rates are still good. Our community level remains low, although if that we will kick into a moderate only based on hospitalization rates. And they, over the last few days, they've actually increased. So you can see our average daily census. There was a time we had no one in the hospital with COVID. And now I think our average now is running right around 5. Kind of a weekly, daily average given on a weekly basis. As I mentioned there, I put this map up there just so you knew what was coming. And the only other thing I'd mention is I am gone next week and teaching a course, the CBO course in the Minneapolis area. So I'll be gone Monday.
The update. Any questions for Joe on the health officer's report?
I did want to mention, you had asked a few other things that I really couldn't compile a good report. I asked the superintendent of schools how the program is going. He had mentioned that. I didn't get anything numerical from them, but I did get what they're doing right now is replacing pictures of the testing. And commercial, this is a hard thing on schools. Commercial fixtures are expensive. So what they're doing is they're basically replacing the fixtures and retesting. And some of them continue to fail, which could be more of a water system issue, pH. There could be some other things driving the lead. Remember years ago, we had the lead and copper rule that kind of drove schools into a frenzy. This one is very fixture oriented, but what they're doing right now is they're changing fixtures and retesting. And they're not keeping much of they're not keeping a lot of data on it. They're just doing it. So really not much else to report on that. But I did ask the superintendents how it's going. And I got a lot of last week. They're really frustrated with this program. The standards they set for this population, I will tell you, I think they're really well. I mean, it's that what they did for, this is not a developmental issue with lead as much as it would be if we were to focus this on the daycares, right? This is when the developmental issues are really high, but in a high school environment, lead may not be as important as the triggers that they set there. And I don't know the history of why this program came about, but it's costing schools a lot of time, effort, and consternation. So that's about all I can report on for that you asked me to last time. Nothing more, just kind of what I got from the superintendents and my last meeting.
There are a couple still outstanding food places that were going to legal. Have those kind of wrapped up? Or are those cases closed right now?
Thanks for bringing that up. Because we have a Pete's chicken that there's
Not mine.
there's actually a warrant out there as a arrest, but we will not pick them up unless there's another outstanding, like a trap. Because of a traffic violation, they're going to bring in for the warrant once operating license.
But it's still in operation.
I continue to hear he operates on a sporadic basis. And the other one is not operating. The one we talked about that was up northwest of Whitefish is not in operation. We're working with that property owner now to try to get resolution before the season starts, but I can't promise you. Very difficult to do.
All right, so then we'll move on to board members, committee reports. I'm sorry, I guess the first big item is the personnel committee. I understand you guys met today.
We met today, but we did not have a quorum, so no decisions were made. We had a little bit of discussion on how to go forward. We're going to set up a meeting next week. And hopefully we'll get a quorum and we'll come forward and something, whatever comes out of that.
Just make mention, it will maybe be, I think Pam's thoughts were making appointments sooner than later. And so a special board meeting may occur the week of the 2nd. So we'll get some viewers out there on the availability.
Your current contract is June 1st, or June 30th.
It's not that far away.
And you're not extending 6 months.
Sir,
All right, I guess the only other committee that's not on here is the environmental committee. Something on that.
you know, we were going to, we actually had discussed, we thought we were going to have at least one variance on Flathead Lake. That variance never came to me. They don't even have the house down to start anything going on. So I'm hoping that a lot of this stuff can be done next board meeting while I can still write them up. This one is going to be an appeal. Roger already downstairs. This is going to be an appeal. I thought I'd give that to you. That will come to the board next month. This is the letter that I sent to the engineer today. This is one of those that it's new construction and doesn't meet the groundwater depth standard. So this letter basically says that I can't move your application forward for a variance. And that only leaves them with the possibility of appealing my decision to you. And they've already made a statement they'd like to do that. So you'll see, we'll do an appeal. I'll meet with the environmental health committee in front of that. I'll try to get an idea of the recommendation moving forward, and I'll prepare the various activities necessary only at the environmental health committee's direction. Since the recommendation will come from the next board. But I thought you better get pretty much a recap of where I am. I do have some other potential variances. We could have several next month. But as you know, I will make them as brief as possible.
Well, once you get your appeal, let us know.
Yeah, I did ask for a formal.
We got to submit that.
I have the variance packet, but I don't have a formal appeal. It's required.
All right, so let's just get a committee reports. I guess we're on to a member discussion. Rob. Next. All right. Yeah.
Happy Memorial Day.
Yeah. This is a great meeting. Low key for a change. So that's the only comment I have.
The only thing I had was talking about the lead requirements. It's really driving the city crazy. But the requirements we're getting there, we've got one man that knows the water system there. I'll say, yes, 8 hours a day attempting to meet the requirements that have been placed upon us. So we know we had no lead. Anywhere we have to look for copper piping. Well, copper piping, not just like copper piping. So it's tough. It's going to be an expensive system. I'm not sure who came up with all this. I think Joe was right on the levels. Setting up. Someone was very concerned about it.
Dr. Avon.
Appreciate the brevity today.
All right. So,
Well, there's Jessica's one.
oh, I'm sorry. Yeah. Jessica, do you have a comment?
I don't have anything to say. Thanks though.
Thank you for your comments on the animal shelter. So, all right, with that, we'll move to adjourn. Thank you all.
Make a motion to adjourn.
So, we're adjourned.